This video completes Chapter 12 of OEC 6, looking at substance abuse and poisoning, and what we really want to focus on here is the management and proper care of a patient who has abused a substance or been poisoned. And we'll look at some specific interventions that we can take. For management of substance abuse and poisoning, your safety is the key. We always want to approach a scene and make sure that the scene is safe, but it's especially relevant if we have, for example, an inhaled poison and something that we therefore cannot control. It may be that from a resource standpoint, we rely on fire officials or a hazmat team before we can safely enter that scene. Generally, treatment of a patient is going to be supportive in nature, and that is, we'll pay attention to the life threats and just respond symptomatically. Perform your primary assessment, address those life threats, ABCDs, and transport the patient to ALS if needed. Now, the respiratory system is one of the things that can be most affected by either poisoning or substance abuse, and so continual monitoring is key. For suspected substance abuse or poison, help is only a phone call away. Make sure that the Poison Control Center phone number is accessible either in your patrol's dispatch area, or some patrollers will even put it on their cell phone. You can decide on the best way to care for a patient by relying on the professionals at a Poison Control Center. Specifically, the generic nationwide number is provided here, and they will give you information about the poison that you've identified from a correct scene size-up, and treatment and recommendations for further medical care. Now, if you happen upon an accident scene on the highway, for example, that involves transportation of a toxic chemical, your first call could go to the American Chemistry Council's Chemical Transportation Emergency Center, or ChemTREC. What they will allow for is emergency response function, and this phone number, 1-800-262-8200, will include information specific to a ChemTREC registered chemical that you may see just in part of your scene size-up on this transportation accident. Now, because so many of these substance abuse situations or poisoning situations have respiratory effects, we can manage that in the field by providing the patient with high flow oxygen and checking their O2 sat with a pulse oximeter, looking for 94% or greater. Few toxicological emergencies have other treatments that we can really provide in the field, so transport to definitive care is critical. Remember, if they depress the central nervous system, we're going to have some respiratory effects. Other things beyond the ABCDs is to just reduce further exposure and reduce further absorption and provide transport. Now, how can we do those things? Well, in the case of an ingested poison, to reduce further exposure, it may come from the Poison Control Center that diluting the poison by having the patient drink water will help. Again, follow medical control or the Poison Control Center. Now, there are contraindications for that. If nausea or vomiting may result, then we've got a second exposure to the esophagus. If the patient has a decreased level of responsiveness, then we may introduce an airway issue by trying to get them to drink something. So we have to be very, very careful. Inducing vomiting can be quite dangerous and won't necessarily reduce the absorption. For reducing further exposure for something that may be transdermal, if that topical poison is dry, we can brush off the particles. We have to be careful in terms of rinsing to make sure that it's a poison that doesn't react with water. For a wet poison, the solution to pollution is dilution. Rinse the affected air with water, and especially if it's exposure to the eyes, we're going to have to irrigate the eyes with copious amounts of hopefully sterile water, saline, or an eye wash station if it's available. In any of these situations, make sure that your PPE provides protection for yourself. In the case of a different route, such as inhalation, we can move the patient away from the source of poisoning, and then in terms of treatment, maintain the airway, provide high flow oxygen, and transport with ALS if we see difficulty breathing as a result of this or altered mental status. If the inhaled poison is still present, do not attempt to rescue. Remember, priority one is scene safety. Let a hazmat team remove the source. To reduce absorption for an ingested poison in particular, activated charcoal will bind the poison and slow its absorption. It's relatively safe, but is most effective if given within 60 minutes following ingestion, while the poison may still be in the stomach and has not moved on to the small intestine. If the medication, for example, in the case of an overdose, was extended release, perhaps it was a coated caplet, then activated charcoal may still be beneficial beyond 60 minutes. Only administer it if authorized by a medical advisor or poison control center. Remember, if a patient has decreased level of responsiveness, this may introduce an airway issue. Don't ask them to take the activated charcoal, which is by mouth, if they have decreased responsiveness. For specific poisoning or substance abuse, in the case of opioid poisoning, if allowed, you can give Narcan or naloxone, or certainly EMS will carry this, and in fact, some law enforcement agencies will carry naloxone and have been trained in their use. Watch for the response for that medication and call ALS. When you give naloxone, the patient may wake up and react violently to that, so keep yourself safe. For carbon monoxide poisoning, 100% oxygen via non-rebreather is best. It may be later that the patient actually has to get not just high volume, but high pressure oxygen, hyperbaric oxygen, so it can reverse the binding of carbon monoxide to the hemoglobin in the blood. Other inhaled poisons, such as fumes or aerosols, can be deposited in the upper airway. And so 100% oxygen is going to be the initial treatment of choice, and this can have the effect of supporting the patient's respiration, but perhaps also helping to dilute it or move it away or slow the absorption of an inhaled poison. Organophosphates and pesticides and herbicides can mimic the effects of nerve agent poisoning. There are specific antidote kits for this that are going to be discussed later in the course in Chapter 34.